So here we're thinking out about the blood supply to the liver. Now the hepatic artery is going to take oxygenated blood directly to the liver. The aorta, as you know, derives from the left ventricle, and the hepatic artery is basically a branch from the aorta. The hepatic artery actually divides into the right and the left hepatic artery, the two main branches of the hepatic artery, taking blood to the right and the left lobe. So the right hepatic artery is going to take blood to the right lobe. The left hepatic artery is going to take blood to the left lobe. But along the bottom here, we notice we have the gastrointestinal tract. So this is the gastrointestinal tract. And this is drained by various veins. So for example, there's the splenic vein draining the spleen. The superior mesenteric vein drains the jejunum and the ileum. The inferior mesenteric vein drains the colon. The gastric vein drains the stomach. The cystic vein will drain the gallbladder and bile ducts, but they will all take blood. All these veins will come together to take blood into this vein here, which is the hepatic portal vein. So basically the hepatic portal vein is draining the spleen and most of the gastrointestinal tract, draining blood straight into the liver. So this is the hepatic portal vein. Now the common bit's about 8 centimetres long. It's in the upper right quadrant of the abdomen. Now a portal vein is a vein which will begin and end in capillaries. So this vein begins in the capillaries of the gastrointestinal tract, or the spleen, carries blood through this large venous section, and then this is going to distribute into lots of small capillaries in the liver. So that means that the blood from the gastrointestinal tract comes into contact with a lot of the liver tissue. So if we describe a portal vein as one which begins and ends in capillaries, and the only other one in the body is the hypophyseal vein from the hypothalamus to the anterior lobe of the pituitary gland, carrying the releasing factors. So why is this arrangement as it is? Well, the gut contains lots of toxins derived from bacteria, and even some bacteria themselves could escape into the blood supply from the gut. That's why in the liver there's numerous hepatic macrophages to phagocytose any bacteria which manage to escape. And also the bacteria in the gut are going to be producing lots of toxins all the time. And we don't want these toxins to get from the gut into the systemic circulation. So the toxins are filtered through the liver first of all. And that's good, filtering things through the liver, because the liver can detoxify the toxins. That's one of the functions of the liver. That means when the blood has gone through the liver and it's going to be drained via the hepatic veins back into the inferior vena cava, which will go back to the heart, of course, that the toxins have been degraded and broken down and metabolized. Otherwise, with these toxins going into the blood all the time, we'd all feel sick all the time, which would just be terrible. Now, if there's cirrhosis in the liver, that's going to make a backlog of this blood in the hepatic portal vein, and that can cause portal hypertension with various complications if there's cirrhosis in the liver obstructing the blood flow. But under normal circumstances, in happier days, the liver, of course, is producing, or the gut rather, is absorbing lots of nutrients which are going to go to the liver to be processed, amino acids and monosaccharides and useful things will be processed in the liver. The biochemical factory of the body, the liver does all this sort of processing. And then once the blood has been through the liver, it's going to drain via the hepatic veins. So blood from the liver lobules, or the central vein in the liver lobules, will collect together into smaller veins and larger veins. Now there's 3 large upper hepatic veins, the left, middle and right, draining the 3 parts of the liver. And there's also several lower hepatic veins. But it doesn't matter too much for the purposes of this talk. They all drain from the hepatic vein into the inferior vena cava. And of course the blood's going to be relatively low in oxygen, high in carbon dioxide. But it's also going to contain nutrients. In periods of fasting, it will contain more glucose because glycogen from the liver will be broken down. And blood in the hepatic vein will contain less toxins because, as we've said, the liver breaks down toxins. And this is also true for drugs. So drugs taken enterally are absorbed via the gastrointestinal tract, but some of that drug is metabolized in the liver. This is called a first pass effect or first pass metabolism. So the first time the drug goes through the liver, it'll be relatively high. It'll be in relatively high concentrations because it's come from the gastrointestinal tract. So it'll be in relatively high concentrations and the liver's able to metabolize a proportion of that. And that's called first pass metabolism. That's why the dose we give of enteral drugs is often higher than the dose we give of drugs that we're going to give intravenously or parenterally via intramuscular injection or some other parenteral route. So the blood supply to the liver, 30% the highly oxygenated blood from the aorta and hepatic arteries, 70% from the gastrointestinal tract for all this biochemical processing. Now it's true that the liver is a very metabolically active organ, so it does need a good oxygen supply. That's why we have the hepatic artery. But of course the blood draining from the gut is not fully deoxygenated. It's probably still got oxygen saturations of around 75%, so it's still useful in terms of oxygen. And finally on this diagram we notice the bile being formed by the liver, which is also draining into the gastrointestinal tract, giving another aspect to this interesting aspect of circulation. So a very important aspect of the circulatory system, processing nutrients, killing bacteria, breaking down toxins, and something we need to take account of in our pharmacology.